and good afternoon. It is Friday, and that means it's time for a regular lunch and learn. And today we're going to be talking about kids, teenagers, and screen time. Now, even though this is a report specifically dealing with depression in children and teens, it also can affect us older people as well. And so I want to just bring this to your attention because so many people are letting their kids be on, devices 24/7. And while I do understand it is a good babysitter, it's not really good for continuity of the family and that kind of thing. Steve and I'll go out and we'll, go out after church on Sunday to lunch, and you'll see these parents, two or three kids, maybe more, and everybody's on their cell phone. Nobody's talking to each other. And so that's something that we know is a real deal, and we know that it is something that is very, very upsetting. So we're talking about this with children. Now, we know that this has become more of a problem since COVID, and COVID was its own situation whenever, we were isolated, we couldn't go to school, people had to stay 6 feet apart. So all of that leads to depression and emotional instability. And so one of the things that the kids do, the teenagers do, they feel awkward because they're just in that stage of life where nothing is going the way it's supposed to. They're gangly, their teeth haven't quite got where they need to be, their hair's not quite where they need to be, maybe they still have some baby fat or whatever, and so they're not feeling just all that confident. And so when that happens, it's real easy to get lost in social media. It's easy just to withdraw and get everything through social media, but this is a pitfall that these children get into. So one of the things that happens is when the children and the teenagers are on social media, they tend to compare themselves with everybody else, and they tend to feel like they come up short. And so that is part of the human condition. I mean, the Bible is very clear that we do not compare ourselves among ourselves because it's just not wise. Everybody is unique. Everybody is who they are. And so when we are comparing ourselves and looking at what other people are doing, then we can get into a state of less than. And so when we get into that, this encourages anxiety, depression, and what we're finding with social media is that depending on where they're looking, it can be grooming them to want to have medication to step out of the depression, to step out of the anxiety, and we don't ever think that that's a really good idea. So platforms such as TikTok have amplified the broad spectrum of voices around drugs for teen anxiety and depression. Now, these voices include psychiatrists educating about various medications, influencers creating sponsored content, and pharmaceutical companies posting advertisements, and even other teens boasting about their own anti-anxiety prescriptions. Now, one of the things that we know with the new, I don't know what his real position is, Health and Human Resources, the FDA, I'm not quite sure, but Robert Kennedy Jr., one of the things that he has been tasked with, and people have asked him to do, is to get the pharmaceutical commercials off the television and off of social media. And I think that's really wise, because you and I can watch that, and the commercials are they're developed in such a way to entice us to find that pain point that we have and to meet that pain point. And so honestly, social media should not do that. Television should not do that. Your doctor should do that. And so that's just a little thing that I'm looking forward to, seeing a whole lot less commercials when we do watch television and we do tune into social media. So today's barrage of medicalized anxiety messaging sharply contrasts with the messaging from just 2 generations ago, with very selective serotonin reuptake inhibitor drugs were first hitting the market, and depression and anxiety was something people did not talk about. The drugs were unfamiliar. It was often a very private solution for very private mental health struggles. Now, I'm okay about mental health not being this cloak and dagger thing, right? We don't have to be embarrassed by it. We don't have to be ashamed of it. And a couple of generations ago, we were. Funny story, I remember my grandmother always talking about her nerves, and I know that in the late 40s and 50s and 60s, that with women, everything was just considered to be hysteria and your nerves, and nobody gave us really the time of day. And so, that kind of made anxiety, true anxiety, something to be ashamed of. It's not something to be ashamed of. True anxiety is quite often the problem of not enough sleep, not the right nutrition, and just different things, including loneliness, including the, locked into social media, and we don't really want that. And so there are other things that we can do with that. So social media has brought more awareness and normalization to teen mental health issues. However, the experts are concerned that lopsided attention given to the quick fix of medications interferes with the efforts to prevent anxiety and depression and holistic approaches which deal with mental health. Research shows that there are risks associated with anti-anxiety and antidepressant medications such as drug dependence and drug intolerance. So what that means is they'll give you, 0.35 milligrams, and then in a month later it's 0.50 milligrams, and a month later it's 0.75 milligrams, and then on and on and on. It just increases because we become tolerant to it. And so that's something that we want to make sure that we're aware of, that this happens. So while they're doing this with the medication, they are decreasing their attention to talk therapy. Now, I'm not really a fan of talk therapy because I'm one that doesn't really want to air a whole lot of dirty laundry. However, our teenagers don't have that much dirty laundry, and just having a skilled professional hear them and walk them through and talk them through can have a much better benefit on their anxiety and their mental health. In the United States, there is much advertising from drug companies that talk about mental health problems. Dr. Joseph Wynn Doring, who is a board-certified psychiatrist who specializes in treating adverse effects from psychiatric drugs, he says teens are less likely to see anxiety as an understandable response to stress and more like a physical problem. And so this is something that's really, really important, because when they're just tuned in to TikTok and different social media that glorifies anxiety drugs and medications, then they're not realizing that they've got to develop the coping skills, because life is not always going to be easy. There's always going to be challenges. There are always going to be things that we need to work through and see how we can cope with that. And if we don't have good coping skills, then we're not going to be able to move forward with our life. He goes on to say, because of the medications that they are prescribed by the doctors, or the kids actually go to the doctors and say, there's something wrong with me, I need this medication. I saw it on social media and it has helped so many people, so many of my friends. And so Whit Doring noted that anxiety is especially normal for teens and young adults who are in the midst of life transitions. So what could those transitions be? Well, I know for me, my parents went through a divorce when I was 12. And so we were raised in a very religious household where it was considered that divorce is a sin. And so whenever we were going through that, it was very conflicting for me, because I had been taught all the things that I had been taught, but here was my life situation, and here was a transition I did not want, and it did cause a lot of anxiety. So, but there's learning how to drive. That causes anxiety. There's learning to date. That causes anxiety. There's getting ready to graduate and go to college. That causes anxiety. So there can be a lot of things that cause anxiety, but they're normal, rite of passage things that happen in our world. Teens are especially prone to preconceived notion that they have a chemical imbalance in their brains. The doctor says there is no test that can accurately assess neurotransmitter levels related to depression and anxiety, and there is no evidence that drugs fix those imbalances. So I thought that was interesting, because a few years ago, maybe about 12 years ago, I was on a cruise with other health professionals, and I was talking to a lady, and she said that she had testified before Congress about alcoholism and addiction. And she said that they had found in their research, and don't ask me who she was because I don't even remember, but I do remember that she said that through nutrition, they could balance the brain chemistry and people didn't need to reach for alcohol or drugs in order to get over that anxiety. And that's a piece that most people do leave out. And I will just tell you that even though you're trying to eat right, even though I try to eat right, it's absolutely impossible in this day and age because of the additives that are in our food and because our foods are nutritionally not competent. And so this is why I make sure that everybody that I love has really good vitamins, and the vitamins are absorbable, and the vitamins can fill up any nutritional deficits that people have. And so it's important to understand that there is no scientific study, and this report that I'm looking at is from April 2025. So this is hot off the press, all right? And so what we need to know is that food can change your biochemistry, whereas the drugs don't necessarily change it, but it does kind of numb you down and that kind of thing. So there was a survey in Education Week. It is a publication for educators, and it found widespread evidence of teens using social media as a platform to diagnose their own and their peers' mental conditions. And I'm just going to throw this out there. There's no teenager alive that is competent enough to diagnose his own or his friends' mental health issues. So the survey found that 65% of school leaders and teachers reported that students sometimes or frequently use social media to diagnose their own mental health conditions. 55% of high school students admitted to using social media to diagnose their own mental conditions at least once. 28% said they do it sometimes, and 10% say they do it all the time. So I'm just going to tell you, as a qualified health professional, Dr. Google does not tell you what you need to know. And when you do research like that and you do those searches, what you're going to find is that everything that you have is going to kill you. So don't do that, because that's not helpful. All right, you need to see someone who is qualified, who can look at you as a total person and can help you get through whatever you're facing. Nearly half of TikTok's most viewed content revolves around poor mental health and includes mental health hashtags, according to the European Child and Adolescent Psychiatry Systematic Review. It found that trending mental health topics, tics, dissociative identity disorder, and self-harm in particular, were associated with an uptick in treatment for those conditions. TikTok has made it a badge of honor for teen users to belong to a community of other teens and celebrities who struggle with anxiety and depression, says Dr. Doring. There's a lot of content out there with people saying, this is the day in the life of someone with major depressive disorder, and here are all the drugs I'm taking. It really normalizes medications for all people. If you see it enough, you start to think, oh boy, this could really help me. I identify with her, I resonate with her, her condition sounds like what I'm going through, and so if that works for her, it's going to work for me. So the influence of social media has on young girls specifically, according to Ms. Kissick, who is a 24-year-old graduate school, and she's been working as a teen mentor. She says it's amazing how persuasive these posts can be. It's even more dangerous for people whose brains are developing because it's targeting them based on commentary. Now, I'm going to give you a little TMI right here, because this has actually happened more than once in my office right here. A mother will come in, she will bring her teenage daughter in, and the teenage daughter says she's very concerned about the shape of her vagina. What? You know? And apparently, these kind of topics are very prevalent with photos on TikTok, recounting surgeries and all the other kind of things that women can do. And we've got these poor 14, 15, 16-year-old girls who are being influenced by these celebrities who are coming in feeling less than, and honestly, the first time I saw that, I was like, what? And so I went to my trusted source, my husband. I am not his first wife, all right? And I said, look, you've seen more vaginas than I have. I'm going to ask you, is there a big deal in the difference of shapes and sizes? And he looked at me like I'd lost my ever-loving mind. So we're just saying, right, I've never, ever thought that there was going to be a problem with anybody in that part of their anatomy, right? However, these young girls are very influenced by TikTok, Facebook, Instagram, Pinterest, all that kind of stuff. And so we really have to watch out for that and make sure that they're getting the right information and they're not spending time locked up in social media. So the algorithms with these social media reach beyond the content user who is already engaging with and showing other teens the same kinds of videos that their friends are viewing. Teens can be bombarded with content about the antidepressant Zoloft simply because that's what their friends are tuning into. Unfortunately, when you get a lot of people together talking about mental illness and ruminating on the symptoms rather than working through solutions, it creates an echo chamber where you all are just getting sicker. And I totally agree with that. I totally do. Many current treatment approaches overlook the complex underlying factors contributing to teen anxiety, such as academic stress, social dynamics, family instability, and undiagnosed learning challenges, says Dr. Cami Benton, a family physician and an integrative practitioner. These root causes often require a more holistic and developmental approach rather than immediate pharmacological intervention. I would definitely agree with that. Increasing tendency to prescribe medications can inadvertently mask fundamental issues, potentially preventing teens from developing critical coping mechanism and understanding the contextual origins of their mental health challenges. In 2020, nearly 12% of children were told by their healthcare professional that they had depression or anxiety, which was up 9.4% from 4 years earlier. Youth complaints of anxiety during doctor's visits were 3 times higher in 2018 than in 2006, rising a 4.2% from a 1.4%, according to the study of pediatrics that examined data from the National Ambulatory Medical Care Survey of Doctor Visits among youth. Now, remember, this is from 2020. What happened in 2019? Lockdown, seclusion, quarantine, all those things. And so, of course, whenever you don't have what you need as far as community, everything was shut down, then you're going to have issues with that. That same period of time, anxiety diagnoses were 3 times higher as teens and nearly 3 times higher in young adults. The rate of those receiving therapy dropped to 33% from 49%. Now, therapy could be talk therapy, counseling, it could be tapping, it could be exercise, it could be a lot of other things besides just drugs. About 62% of those diagnosed were given an anxiety medication, with 45% receiving SSRIs and 18% receiving benzodiazepines, which can be dangerous. Moreover, the child psychologists were even more likely to practice in high-income counties with higher level of education, and metropolitan counties versus surrounding areas. In other words, there were disparities among access to these professionals and to the services. So SSRI, particularly Prozac, Lexapro, Celexa, and Zoloft, are the first-line treatment for anxiety, along with cognitive behavioral therapy, which is a part of the science that focuses on helping teens identify unhelpful patterns of thought and behavior and helps them develop better coping skills. Prozac is often used as a primary treatment option for anxiety alongside cognitive behavioral therapy. Now, I will just tell you, people in my family take Prozac and they are no better. I mean, I'm just telling you, they are no better. I have never known anybody to take Prozac and get better. So that's just my professional opinion, but it's also my human experience with the people that I know that take Prozac. The report goes on to say that the reduction in therapy during office visits and a greater reliance on medication for anxiety disorders may reflect growing resource constraints in the office setting in the context of a child and youth mental health crisis that has been building over time. Breaking that down, it just means when you've got your 15 minutes with the doctor, there's just not a whole lot they can do other than prescribe you your medication. And this is why when you're looking at treatment, you're looking at holistic treatment, then you're going to want to have more than 15 minutes so that you can tell exactly what's going on. This is my concern. This is my anxiety. This is what I'm worried about. This is what I can't seem to get over. And then you've got people who are qualified to help you. And it doesn't always have to be a mental health professional. It can be a trusted teacher. It can be a trusted pastor. It could be a trusted aunt or whatever. These people can help you. So there is a geographical shortage of child psychiatrists. So in a pediatric report noted that while the profession was growing, access was not. In 2007 and 2016, 70% of U.S. counties had no child psychiatrist. That's crazy. You would just think that they're just all over the place. Any prescribing doctor can give a teenager SSRIs or any other anxiety medication, which are considered safe by the American Psychological Association. Doctors, however, may not share adverse effects because they think they are rare. Wilt Doring is a healthcare professional, and he says other professionals may not discuss therapy or exercise, adequate sleep, good nutrition, which are all foundational factors that can contribute to poor mental health. Now, I know as a human being, if I do not get my sleep, then I'm going to be a little bit, on the grouchy side the next day. If something doesn't go the way it needs to go, I could have anxiety. If I'm, concerned about bills or I'm concerned about taxes, of course, we just went through tax season, all those kind of things can produce anxiety. When you are healthy in your body, when you are healthy with sleep, when you are healthy with exercise, you tend to have the reserves that you need in order to figure out a solution on how you're going to address and meet those challenges. So we want to make sure that when we're looking especially at children, we want to make sure that they're not on their tablets all night, that they're not watching television all night, that they're not, I know I've got grandsons that play games, with other people on their, I don't even know what it is. I'm just out of it. But I do know that they do play games with people on the internet. And so when that happens and people aren't paying attention, that can go way into the, midnight hours. I don't know that my grandson does that. I haven't really asked. But I'm just saying all those things can go on, which robs your teenager of sleep. And when you don't have enough sleep, you cannot cope with what's going on. So Wilt Doring says that medication should be the last resort, particularly for teens, and only used for immediate suffering. The rush to a fast solution with drugs can turn into a game of Russian roulette. Why is that? Well, because it takes 2 to 6 weeks for the medication to get in the body at the rate that it needs to in order to affect a change. And so if medication doesn't feel right after a week or two, you change, and that doesn't feel right, and you change. You're not really giving the drug time to get in the body and do what it needs to do. So those are some things that are really happening with the children, with the teenagers, and probably even with adults with anxiety and that kind of thing. So part of the problem with the teens and the children is they're not compliant, right? How many of you have had teenagers and they didn't do what you told them to? They didn't eat what you told them to. They didn't go to bed when you told them to. They didn't get off your devices when you told them to. Kids just don't have a whole lot of compliance. And if you're working with medication to address healthcare issues, you need to have compliance, all right? So antidepressants do have side effects. They numb the brain down much in the way that alcohol and narcotics do. This can be therapeutic in very, very severe cases. However, relying on drugs also inhibits long-term resilience. There are other things that happen, and some people feel really flat on medication, so they become kind of somewhat disassociated from life. So I used to be a teacher back in the day, and I absolutely loved being a teacher. But we had this little boy, and I absolutely adored him. He was very quiet. He never, never did anything. He was flat. All right, good student, good family, loved the family. Somehow during the semester, they ran out of his medication. He was on some kind of ADD, ADHD medication. And I really couldn't tell you timeline and all that. I just noticed one day, oh my gosh, this child has a personality, and he's funny, and he keeps the class in stitches, and he's still bright, he's still smart, but he has such an adorable personality. And his father had come in and said, look, I'm sorry, he may have been a handful because, we ran out of medication, insurance wouldn't let us get medication. And I looked at that father and I said, look, he is absolutely delightful. Please don't put him on his medication. He is fine. He doesn't need it. And the dad said, no, we think he's better off with the medication. I was heartbroken because this child, this developing child, had so much personality, but nobody could see it because, hello, he was overly medicated. So one of the consequences of SSRIs can be life-altering. So why? Suicidal thoughts and behaviors, mania, seizures, sexual dysfunction, including decreased libido, erectile dysfunction in men, and absent or delayed orgasms in women. Now, probably we don't care about this with teenagers because they should not be sexually active. However, should and are may not be the same thing. So this kind of thing is really, really important. And then the last thing is the discontinuation syndrome when you want to stop your medication, which causes nausea, sweating, mood, cognitive issues, insomnia, and other symptoms that that happen after abruptly stopping the medication. So if you are going to stop the medication, you want to stop it very, very gently. You want to wean off of it so that you're able to maybe bypass this. However, the report goes on to say that some people who have been on this anxiety medication and a depressant medication, they have had symptoms of withdrawal over 2 years, okay? And so we really want to be careful about that. So what can we do holistically, right? Well, as I said before, you can do nutrition, right? A really, really, really good vitamin. And what you're getting at the grocery store, buy one, get one free, is not a good vitamin. I'm just telling you. We've got the scanner here that we can actually take your hand, put it on a laser, you just hold the device, and in 30 seconds we can tell you what your vitamin uptake is. Why is that? Well, because vitamins are made from what? Food, fruits, and vegetables. So what gives your fruits and vegetables your dark colors are your bioflavonoids. Now your body takes those bioflavonoids, which are your vitamins, and it turns them into antioxidants in your system, which helps you not age, and it helps your immune system. And so with this device, we can know whether or not you're getting enough nutrition from your fruits and vegetables. And guess what? Most people do not. And so we want to make sure that all of our teens who are suffering with depression, we want to make sure that they are on a very good bioavailable vitamin. We also make sure they're having adequate sleep. We want to make sure that lights are out by 10 o'clock. And I know that's like heresy because I talk to my kids all the time, and they're up till 11, 12, 1, 2. And that's just not conducive to repair of the body. The body starts to repair about 10:30, and so you need to be at rest so the body can do what it needs to do so that you can be who you're supposed to be. So good sleep, good nutrition, no or very, very low fast foods, right? Anything in a box or in a package, right? I posted on our Abundant Health and Wellness page, I think it was yesterday, it may have been the day before, a comparison of foods in a box and a package, what is allowed as far as additives here in the United States and what is allowed as additives in other countries around the world. So if you want to see that, I mean, you might be mind blown to know that a box of Fruit Loops is not the same all over the world. And so thankfully, we've got an official in charge now that is going to change that, or he says he's going to change that. And hopefully we'll be a lot better for that. But no, nothing in a box or a package, no fast food, good sleep, good recreation, a lot of sunshine, a lot of outdoors, a lot of community. And all of that are holistic ways in order to teach the children coping skills. If your child has anxiety, there are things that we can do holistically. Maybe the neurotransmitters are out. Maybe the hormones are out. Maybe just flat out nutrition is not good. And so let's do that. Let's address that before we reach for a SSRI or a benzodiazepine, right? There's not going to be any undue side effects from holistic medicine. There's not going to be any undue side effects from extra sleep, okay? So that's a lot. I appreciate you spending this 30 minutes with me. It's the weekend. Go outside, relax, rejuvenate, refresh. If you have any questions, pop them in the box and I will get to them. Share, like, comment. That's how Facebook knows that we're doing something really important here. And again, thank you, and I will see you next Friday.